I speak now to Dr. Michael Baker, who's a professor of public health at the University of Otago and joins us now live from Wellington. Welcome to the programme. Lots to speak about, of course, so much is happening right now. But with regards to New Zealand, I understand Omicron has been detected there. How are authorities reacting given what we're seeing around the globe?
Well, greetings from Wellington. Yes, of course, we are very concerned about the emergence of this new variant. New Zealand has basically operated an elimination strategy for most of the last 18 months. And it's only recently that we've actually had sustained transmission of COVID-19 in New Zealand, and that was a Delta variant for the last 4 months. But we've kept numbers very low with quite a tight suppression approach. We had our first Omicron case detected in quarantine today. Now, New Zealand still runs very tight quarantine. You've got to go through a minimum of a week, and you have testing. And this has proven very effective at keeping new variants out for long periods. So this is the approach the government will take. So we don't have any circulating virus in New Zealand at the moment.
How confident are you that the current vaccines we have will be enough to tackle a variant that we've only known for the past few weeks?
Yeah, well, look, we're observing what's happening internationally, and the evidence seems to be becoming very clear that this variant does have the ability to evade the immunity that is produced by vaccines. Not totally. You still retain quite a bit of the protection against serious outcomes and death, but the protection against infection is very poor. So this variant will sweep through a population very rapidly.
And so is a booster shot, of course, if you can and are lucky to be in a country where you can access one, is that enough?
Well, it does seem to restore a lot of the protection of the vaccine. It's the same for the Delta variant. The booster shot does restore a lot of the protection against infection, and it seems to, again, help very much against this new variant. So we are seeing policies to get that booster dose at a shorter interval, and I know in New Zealand we'll be looking at shortening from the 6 months. We might follow Australia, which is reduced to 5 months, or the UK, which has reduced it to 3 months.
And speaking about the UK, the Chief Medical Officer, Chris Whitty, gave a press conference yesterday, and he spoke about the fact that we've over-interpreted the severity of Omicron, given that we've been hearing that it's milder from South Africa. How dangerous is that?
Yeah, well, look, this is the big measure or parameter that we most want to know about at the moment. And it's often the hardest thing to measure. You do need data for several weeks or even a couple of months to estimate this, because so many factors affect outcome, particularly the age distribution of the people getting infected, their immune status from vaccine or natural infection, comorbidities. It's a very hard thing to measure accurately. You can't measure it early on in a new pandemic wave because poor outcomes take weeks to appear, from infection to being hospitalized to death. You're usually looking at about 4 weeks. So it will be some time before we know what this is. But this is the key measure that I think the whole world needs to know about.
All right. Thank you so much, Dr. Michael Baker from the University of Otago in Wellington. Appreciate your time. Thank you.
Thank you.